Welcome to our next hot take segment. I'm Alex Knettel, the Client Relations Manager here at Facktor, and I'm here today with two of our amazing licensed clinicians, Ryan and Manisha. Ryan, would you like to start by introducing yourself?
Sure. Hey, everyone. My name is Ryan Rizik. I'm a licensed clinical social worker. I've been with Facktor for just over 3 years now, and I'm a manager in our clinical operations division. I'm happy to be on the call today.
Great. Manisha.
Yes, hello everyone. My name is Manisha. I'm a family nurse practitioner. I joined Facktor three months ago, and prior to that, I was working at an FQHC here in Los Angeles for 4 years, where I was a full scope family nurse practitioner, so peds, OB, women's health, adult, geriatrics.
I'm hoping to talk a little bit today about clinical integration, and that phrase means so many things to different people. As clinicians, what do you think about when you hear someone mention clinical integration?
You know, as a clinician, primary care clinician, I really think of it through the lens of the patient. You know, from the moment the patient walks in to the health center, how does the health center make it easy for that patient to navigate all the services they're receiving, from registration to being groomed, to seeing the clinician, to getting checked out, you know, dental, behavioral, all the services a health center is going to offer. And from a primary care standpoint, you know, I want to also, as a clinician, know that I have all the information I need to be able to take care of the patient so that they can have the best outcomes.
I just wanted to add too, you know, we think a lot about our integration, and you know, there's integration with external organizations, and then there's also integration with internal organizations. And you know, a lot of times we see organizations operate in a way where it could be very siloed, right? Medical is doing medical, behavioral health is doing behavioral health, dental is doing dental, but there's not a lot of conversations between those teams. And that leads to a detriment to the patient, right? When we do have a collaboration between those teams, it allows people to have the full picture and utilize all of the information available to help that patient be successful in their treatment.
You know, to build on what Ryan's saying, you know, I talked a lot about those external elements, you know, and that those internal elements, really communication, right? I can give an example of when the health center I worked out on the second floor, we had dental and, you know, medical right next to each other. And a patient had come in for, you know, just a routine cleaning, and their blood pressure was really high. And so, you know, dental team, you know, came over and said, hey, we have a patient here. We, you know, unfortunately can't do their cleaning because their blood pressure is really high. Can we get them in with the provider? And we did. We found a walk-in slot, and, you know, we were able to get them in. And yeah, sure enough, we lost contact with them for, you know, over 3 months and had been off his medications. And so that was just such a seamless transition of, even though the patient was here for dental services, we got them transitioned over to the medical care team. We were able to get him in and, you know, focus on his blood pressure and hypertension management so that he can come back and get his teeth cleaned. So these are, you know, warm handoffs really matter, especially in behavioral health, like Ryan was saying, and really strengthening that, you know, interdepartmental communication and realizing everybody in the health center is a part of that patient's care.
Great, thank you. Where's a good place for a health center to start when either beginning or strengthening their clinical integration journey?
There's no one size fits all, right? When we're talking about organizations, there's many different types of organizations. There's different staffing structures, there's different tech capabilities, company cultures, among other things. So we just want to be able to keep that in mind. But the most important thing, and, you know, Manisha, I think you're on board with this too, is that we want to start, you know, where the health center is at. So if we're trying to reach and create a huge sort of project, that's a lot of times where we see organizations break down, right? We know a lot of organizations have had clinical integration efforts, but by keeping it sort of smaller, low-hanging fruit, easy wins, we can really set the stage for being able to walk a health center through a process that's going to be sustainable and able to be successful with its staff members.
Well, thank you so much, Ryan and Manisha. I appreciate your time, and we'll chat soon.
Thanks, Alex.
Bye.